Hello, my name is Anani James, and today I'm going to be doing the blood glucose check off. So the first thing I'm going to do is verify my physician's orders and verify my patient with 3 patient identifiers. After doing that, I'm going to perform hand hygiene and don clean gloves. After donning my clean gloves, I'm going to go ahead and tell my patient to wash their hands and dry them. After they wash and dry their hands, I'm going to take their hand and I'm going to go ahead and wipe it off on the lateral side. After doing that, I'm going to turn on my machine and put my strip in. I've already picked the lateral side of the finger and wiped it. So next, I'm going to take my lancet and I'm going to prick. I pricked. It's bleeding. I'm going to wipe the first drop of blood off with the cotton ball and I'm going to lightly squeeze. After lightly squeezing, I'm going to take my machine, put a drop of blood on the strip, and I'm going to wipe this off and apply a little pressure. After doing that, I've got my results. And I'm going to read my results, which came out to be 252. I'm going to document that, and I'm going to turn off my machine. After doing that, I'm going to disinfect it and take off my gloves, perform hand hygiene, and explain to the patient the results that have been made. Hello, this is part 2 of the insulin administration of the blood glucose check. So the first thing I'm going to do is verify my physician's orders. I'm going to go in and verify my patient with 2 different patient identifiers. After doing this, I'm going to perform hand hygiene and don my gloves. While donning my gloves, the blood glucose was 252. Signs of hypoglycemia: the patient will have a decreased level of consciousness. Hyper, they'll be doing things like having the 3 P's. Yes. So the first thing I'm going to do is compare these to the MAR and look at the expiration dates on both. The MAR is fine. The MAR does match up with the medication and it is not expired. Next, I'm going to roll my valves in my hand. After doing this, I'm going to take an alcohol swab and wipe the top of the valves off. So next, I'm going to take my needle. I'm going to put, for what was ordered was 16 of NPH and 6 of regular. So I will draw up or aspirate 16 units of air in this needle. I'll uncut my needle. I'll put the needle in without it touching the solution and put the air into the valve, take it out, and I'll aspirate 6 units of air. Put that into the regular and put that. Next, I will go ahead and draw up those 6 units. And quickly after, go ahead and draw up that 16. I'll safely recap my needle. In all, it's 22 units of insulin. So after doing that, I'm going to go into my patient's room. I'm going to explain the procedure, see if they have any questions. I will go ahead and get that 3rd patient identifier. I will identify sites, so I can do it in the abdomen, I can do it in the thigh, I can do it in the back of the arm. Those are just a few sites that insulin can be injected in. It has been given, after checking the MAR, it was given in the left lower side of the abdomen. I've looked at that side. I'm going to give it in the right lower side of the abdomen. So I've looked at that. Everything looks good with the skin. I'll go ahead and clean it with an alcohol swab, and I will get ready to inject my medication. So I will go ahead and pinch the skin, and I will inject at a 45-degree angle. After doing that, I will take out my needle, put it in the sharps container, and hold with the alcohol swab. After doing this, I will go ahead and take my gloves off, perform hand hygiene. I will document and have the patient towel ready to do.